The theme of innovation has always played an integral role in the healthcare industry, and often using this to challenge the small, everyday processes can create the biggest impact.
I saw a need for the Needlesmart product in the fact that the sharps disposal method that's globally accepted is to a larger extent out of date and dangerous to the healthcare worker who is responsible for the disposal. Needlesmart is an innovative solution to sharps disposal. We have a range of products that will deal with the disposal of a hypodermic needle directly at the point of use. I was approached indirectly to work on a product not dissimilar to Needlesmart some years ago because I have a background in mechanical design. I've worked myself for large OEMs such as Bentley, Rolls-Royce, to name a couple, and in the process of doing that, I've applied that skill set directly into a product to destroy a hypodermic needle. I believe that Needlesmart can help the NHS on a number of levels. From a healthcare worker's point of view, I believe that it can have a direct impact on some of the post-procedural needle stick injuries. On a financial level, the cost of clinical sharps disposal can be significantly impacted by the implementation of the Needlesmart product range.
The Needlesmart Pro is a simple system for rendering a post-use hypodermic needle safe. The process is started by applying a light pressure to the needle aperture. After 2 seconds, the process is complete and the needle can be removed. It's as simple as that.
The benefits are that once used within a Needlesmart product, the needle itself can never be used again. It's been heated to 1300 degrees, so there is nothing living on the sphere that's created at the end. It has a direct benefit on the cost of disposal, and it has the facility to create a reorder process for the end user to order needles for future use. Needlesmart has faced a number of barriers engaging with the NHS market. We've overcome this by directly working with consultancies who have significant entrance into the NHS and relationships within it. And in line with that, we've also engaged with the academic community who have engaged themselves with the NHS markets within the city region, so that we have access on a number of levels which, from a small SME point of view, is difficult to achieve with an organisation the size of the NHS. The product itself, in engineering terms, is what we would call pre-production. It's going through a series of tests, both internally and feasibility into the NHS in early 2018. There is an EU directive which came into force in May 2013, stating that if there is a sharps protection device available, it should be used. A lot of companies have gone around developing a safe needle. I actually didn't think there was anything wrong with the needle, and I thought that the way in which we could help was dealing with the downstream waste disposal of the needle. I think innovation can help any industry, and indeed the healthcare industry, by eliminating gaps that appear in traditional processes. So, for example, in a supply chain operation where you would historically have several tiers of personnel in the ordering process, if you can have a product such as Needlesmart which captures the need for a reorder of needles and sends that directly to the manufacturer via the internet, you've eliminated both time, resource and indeed money in the process. I'm extremely proud of the journey we've taken to date. As a business, we've successfully raised a huge amount of investment into the company. We've applied that investment directly into R&D. We have a design team who are second to none and have developed a fantastic range of products. That has been directly translated into engagement with the NHS, whose engagement to our business has been fantastic to date. We held our first event specifically to the NHS, at which we had 25 representatives of trusts attend, of which 13 of whom have agreed to take feasibility studies from us. The future looks fantastic for Needlesmart. When we launch the product, we already have a number of expressions of interest from across the healthcare sector.